Chairman Schatz, Vice Chair Murkowski, members of the committee, and those who have spoken so expertly and passionately today. Thank you for the opportunity to testify on the issues of fentanyl, the opioid crisis, and the impact on Native communities. My name is Eric Gettis. I serve as Senior Vice President for Behavioral Health at Southeast Alaska Regional Health Consortium, known as SEARCH. SEARCH is an Alaska Native-controlled tribal organization. We are authorized by the resolutions of 15 federally recognized Alaska Native tribes to administer comprehensive health care delivery for the Tlingit, Haida, Tsimshian, and other residents of Southeast Alaska. Founded in 1975, SEARCH is one of the oldest and largest Native-run health organizations in the nation, with a service area stretching over 35,000 square miles. SEARCH is accredited by the Joint Commission and operates 2 critical access hospitals, 2 long-term care facilities, and 22 rural community health centers. The decades-long opioid crisis has impacted communities across the United States, and multiple studies confirmed here today show that Alaska Native and American Indian people are disproportionately impacted by opioid use, opioid-related overdose, and opioid-related deaths. The Native communities of Southeast Alaska continue to suffer through the heartache and despair brought about by substance use. SEARCH has addressed opioid use disorder over the past 10 years by significantly reducing opioid prescriptions, promoting holistic interventions for pain management, implementing harm reduction services and activities, and providing buprenorphine and naltrexone throughout the region. Recognizing more services were needed. In February 2022, SEARCH opened an opioid treatment program, or OTP, in Juneau. OTPs are the only facilities that offer patients all 3 forms of medication for opioid use disorder: methadone, buprenorphine, and naltrexone. No other setting is permitted to provide methadone. OTPs are critical to reducing overdose deaths and providing life-saving addiction treatment. In the past year, SEARCH added 2 additional OTPs in Sitka and in Klawock. Before these programs opened, those with opioid use disorder had to physically move hundreds of miles away to Anchorage or Seattle to engage in treatment. Our programs have dramatically improved people's lives, yet serious challenges remain. Fentanyl has rapidly replaced prescription opioids and heroin as the primary driver of opioid misuse in Southeast Alaska. Fentanyl is profoundly potent, quickly physically addictive, easily attainable, and has a very short half-life, leading to escalating quantities of use and lethality. This has led to yet another widespread wave of opioid use, resulting in more overdoses and preventable deaths. We consistently find patients developing dependence on fentanyl over relatively short periods of time. It is essential that treatment and medication for opioid use disorder be available and expanded. The COVID pandemic allowed several long-standing OTP regulations to be eased. These revised rules improved treatment availability by permitting telemedicine and allowing prescribers more clinical discretion for some methadone take-home administration. SEARCH wholeheartedly supports maintaining these relaxed emergency regulations. However, there are efforts around the country seeking to ease methadone regulation even further. We urge great caution with these proposals and recommend that methadone remain part of a comprehensive opioid treatment program. Access to and availability of harm reduction services and overdose reversing medications is paramount for saving lives. Oftentimes, these medication supplies are limited. Additionally, preconceived beliefs about substance use and associated stigma prevent harm reduction services from being accepted in some communities. Changing our words and descriptions, helping communities reframe beliefs, and realizing that people can and do recover are all essential components to battle stigma. Finally, as a nation, we must recognize the necessity of developing a strong behavioral health workforce. Native communities across Alaska continually struggle with inadequate staffing. Behavioral health specialists and peers have long operated in an under-resourced system that discourages many from entering or remaining in the field. Effective treatment requires qualified, compassionate professionals grounded in culturally responsive practices and relationships. These are the fundamental elements that foster healing and recovery. In conclusion, Search truly appreciates the opportunity to speak before the committee today on this very important issue. Thank you.
Thank you, Mr. Gettis. And our last witness will be Dr. Soto. Thank you for joining the committee today.